Welcome to Sleep, Sex, and Senility, where we explore the fascinating connections between sleep, oral health, cardiovascular health, hormones, brain health, and longevity. I'm Dr. Kathleen Carson, an oral systemic focused dentist.
And I'm Dr. Ellie Campbell, an integrative physician focused on prevention and healthy aging. Together, we bridge the worlds of dentistry and medicine to uncover how the health of your mouth may influence the health of your entire body.
If you enjoy these conversations, please like and subscribe to the podcast so that you never miss an episode. And if you'd like to stay up to date on new episodes, emerging research, and practical health insights, visit our website and sign up for our monthly newsletter using the link on our homepage.
Now, let's dive into today's conversation.
Before we begin, a quick note. This podcast is for educational purposes only and does not provide medical advice. Please consult your own healthcare provider for recommendations specific to you.
Hi, welcome back to Sleep, Sex, and Senility. I'm Dr. Kathleen Carson, founder of Oral Vitality, an airway-focused dentist, and an oral systemic one. And I am passionate about helping people understand that the mouth is not separate from the rest of the body.
And I'm Dr. Ellie Campbell. I'm double board certified in family medicine and integrative holistic medicine. And after doing this for over 35 years, realized that somewhere along the line, somebody disconnected the head from the rest of the body. And once I started to understand the intricate oral systemic connections, my entire practice got better. My patient outcomes got better. My diabetes control got better. My cardiovascular risk disease got better. And I decided it was a secret I could not keep to myself. And Dr. Carson and I together created this podcast on sleep, sex, and senility about the many ways your mouth is connected to the rest of your body. So we learned recently that mouth breathing can age you. Most of us do not want to age any faster than we already are. So are there some secrets that our mouth is keeping that might help us age more gracefully?
Absolutely. And as in the dental office, especially as an airway-focused oral systemic dentist, I see mouth breathing all the time. And people have no idea that this just isn't a normal way to breathe. But the reality of it is it's going to disrupt your sleep. It's going to increase your systemic inflammation. It's even going to make your face look like it's aging. Dark circles, puffy eyes, a dry mouth. Dr. Campbell can tell us all about the hormonal impact it has. It ages our brain. So it's not just, a bad cosmetic habit that dries out your mouth. It actually has huge ramifications on your oral systemic health and how quickly and visibly you age.
Yeah. It's funny because once you start to pay attention to this, you kind of walk through Walmart and the airport going, mouth breather, mouth breather,
Yeah.
mouth breather. That person's got an airway problem. And you know that there are so many things that can be done to help mitigate that and to retrain the body to not breathe through the mouth. And to, in some cases, it's a surgical repair, but in some cases, it's just a habit repair. And runs the gamut from all of those and in between. So let's start with the physical exam. What are some exam findings that the dentist might see that clues them into the fact that the patient's a mouth breather? Because obviously everybody has to mouth breathe at the dentist, right? We got to open our mouth for you to see what we are. So during the middle of the exam, that's not the best time to be able to say, do you do this when you're not in my office? But tell me about physical exam findings. What do you see that clues you to a
Well,
mouth
and
breather?
to your point, once you know what you're looking for and you're starting to pay attention to it, it starts before the patient even opens their mouth. You can just sit there and observe somebody sitting there habitually breathing. What does their mouth look like? And then you're going to notice maybe their lips are dry, the muscles look a little bit more lax where they should be taut. But the dentist role, these days, it's not just teeth. It's about the airway too. So then when the patient opens their mouth, we might see some wear on their teeth. Maybe they're clenching and grinding at night. We might see a high arch to their bony palate, that upper jaw portion. And if you think about this, the roof of your mouth is the floor of your sinuses and your nasal cavities. So if you have this high arch palate, it has to go up there somewhere. And oftentimes we'll find, a deviated septum that goes in line with that. Maybe there's some recession around the teeth. There could be some drying out of the mucosa, the salivary flow that's so protective for our body and our microbiome. That gets altered. The bacteria in the mouth change. You can see dark circles under their eyes. Another thing I look at quite often is I'll ask patients every day, multiple times a day. I seem to ask everybody, breathe in through your nose and then take your fingers and put a little pressure to the side of your nose and push in and pull out. Breathe in again. Does that get easier? Or does it stay the same? And I would say 8 out of 10 times at least, it gets easier for patients because they've got a valve collapse in there. So there's so many things as a dentist that we can ask questions and look for signs. And then, bring up, how are you feeling rested when you wake up? Do you have headaches? Because we know if you're not breathing through your nose, the oxygen isn't being delivered to the rest of your body like it should be when you're sleeping. So a lot of times we see patients waking up with headaches. They wake up knowing they've been clenching and grinding. How about you, Dr. Campbell? What are you looking at when you see the patients?
Yeah. So, in medical school, we're taught we stick that tongue depressor inside their mouth. They say, and we get out of there. And that's all we need to look at. Right. And so, one thing that I did see when I did that very cursory exam was a large swollen uvula.
Yeah.
If the patient's uvula, that little boxing glove thing that's in the back of your throat, if that is larger than it should be for the patient, they're probably causing a lot of inflammation and extra airflow at night while they're sleeping. They're likely a snorer at night. So I pay attention to that now. I pay attention to the shape of their jaw. It should be a U, but in some cases it looks like an omega where the back teeth are spread farther apart than they should be. And that omega arch is an indication in some cases that they have sleep disordered breathing or a problem at night, because mouth breathing can be a problem in the day, in the night, or both. And so when it is continued even into the daytime and you watch somebody sitting at their computer with their head in this deep forward posture and their mouth open while they're typing away at their computer, they have an airway problem. And it's even infiltrating the daytime, not just when they sleep. So dry mouth, something that I see, very sticky looking tongue, a tongue that's swollen so that it's so big it doesn't even fit in the mouth, and the edges of the teeth are scalloped like a shell, like a scallop shell, and you see those ridges on the side of their tongue. It's like, oh, that person could have an airway problem. When they tip their head back and I look at their nostrils, if one nostril is a little tiny and one is big, then that can be an airway problem. And look at their nasal septum, that little wall that's supposed to separate the left and the right side of the mouth. If that septum is crooked, they probably have a nasal airway problem. If they have a nasal airway problem and they can't freely breathe through both sides of their nose, they're going to have to compensate to get air somewhere. And that means opening the mouth to get their air in. And when they do that, the more they breathe through their mouth, the more their nose forgets what its job is. And that develops a condition called nasal disuse atrophy. And the nose stops being able to exchange air the way that it's supposed to, stops being able to make nitric oxide the way it's supposed to, stops being able to warm the airflow the way it's supposed to. And all of those can lead to downstream problems. Another thing that I see now that I pay attention to that I didn't before is when I ask the patient to stick their tongue out and say, can they get their tongue out? Can they get their tongue out far enough or up in the roof of their mouth? Because sometimes they're tongue-tied. They've been tongue-tied their whole life and nobody ever mentioned it to them. But that fascia restriction in their oral cavity can lead to a huge problem of not getting deep airflow into the lungs where it belongs. And so getting the patient to a dentist who can evaluate their tongue tie, or an ear, nose, and throat surgeon that's skilled in this method of evaluation to make sure that their mouth is adequate for the size of their tongue and that their tongue is freely able to move inside their mouth. So those are some of the physical exam things I see. When I listen to their chest, if I hear irregular heartbeat, I wonder about their airway. If I listen to their lungs and they're wheezing, I wonder about their airway. If I see hypertension, high blood pressure, I wonder about their airway. Because in my world, every single patient with elevated blood pressure, hypertension, deserves an airway evaluation. They deserve a sleep test to make sure that their blood pressure is not a reaction to the problem that they're not getting enough oxygen rather than a cause of a symptom all by itself. So
Sorry,
lots
you
of
guys.
things.
We're not good. So let's talk about nitric oxide then, because if we're not breathing through our nose, we're not producing the nitric oxide to the same capacity that we should be in two different ways. One, because we're producing it in our sinuses. But two, if the bacteria are disrupted in your mouth and on your tongue, then we don't have that pathway either. And we know this is going to age us. And again, this is, connected to the miracle mouth molecule that we all now know is nitric oxide. We've talked about it on a couple episodes, and mouth breathing bypasses both those productions. So, how might that age us, Dr. Campbell?
Well, so many ways, right? So nitric oxide is really interesting because it's so important. It won the Nobel Prize. It's a gas and it regulates so much. It regulates our blood vessel ability to relax. So without enough nitric oxide, our blood vessels stay contracted, and that means elevated blood pressure. But that also means less blood flow to the pelvic floor. And if you're male, that means you may have some trouble with erectile function. And if you're female, you may not be able to reach orgasm when you're having sex. So, nitric oxide is really important for blood flow to the whole body. And we worry about our heart and brain, but it also affects our pelvic organs too. So, that's one of the many things that nitric oxide does. It allows more oxygen to be delivered to our muscles. So we have better exercise performance. And we all know the importance of exercise, right? If we want to age more gracefully, we know that we must be doing regular physical exercise, lifting heavy things and physically moving our body. Well, if we're not getting adequate oxygen to our cells and tissues, we're not going to feel motivated to exercise and we're not going to get the benefits of the exercise when we try it, and we're going to be too fatigued. So we have to get oxygen to our tissues. We also know that this signaling molecule supports the immune response. And so without nitric oxide, we have a higher propensity to catch infections, to catch that cold or flu or whatever virus is going around in the neighborhood, or worse, a bacterial infection such as pneumonia. So we need nitric oxide for immune system. And finally, not finally, but among the other important roles of nitric oxide is insulin sensitivity. And so we know that our bodies have to take insulin out of our bloodstream, attach it to the cells to deliver blood glucose for sugar to do all the good things. If that doesn't work, we build up insulin, that gets too high, our sugar levels get too high, and now we have a blood sugar problem that can lead to all sorts of other things, as if little shards of glass are going through our bloodstream with all those high sugar molecules poking microscopic holes everywhere in our body. You can imagine how that would age our tissue really fast. So nitric oxide, they called it the miracle mouth molecule for a reason. It has so many downstream metabolic effects that without it, we're really up a creek without a boat. And we need nasal breathing to get the most nitric oxide. So it's important.
Well, and along the same line, too, if we're breathing through our nose, we're activating the rest and digest, our parasympathetic nervous system.
Right.
Whereas when we're mouth breathing, there's evidence out there that we're maintaining that slight activation of our sympathetic nervous system, that fight or flight status.
Right.
And we know that ages us differently as well. That can speed up all sorts of inflammatory pathways and chronic
Right.
health ailments.
Absolutely. So imagine you're about to be eaten by a grizzly bear, right? The following things are going to happen to you instantaneously, whether you want them to or not. Your pupils dilate, your mouth gets dry. You open your mouth to breathe really fast to try to get more oxygen to your tissues. Your muscles get really strong. Your blood pressure goes up, your blood sugar goes up, your blood cholesterol goes up so that your body has all of the molecules that it needs to do this amazing thing to fight that grizzly bear to the death. or run away, right? Fight or flight. It's beautiful, life-saving, instantaneous reaction. You have almost no control over it. And that's great when there's a grizzly bear there. But when there's this many emails and this much time or this many bills and this much money, you don't need to have a life-threatening reaction with high blood sugar, high blood pressure, high cortisol, high adrenaline, all these things that are life-saving when there's a grizzly bear. In today's modern society, we have activated that sympathetic nervous system with much less life-threatening stressors. And so when I go to the doctor with high blood pressure, high blood sugar, and high cholesterol, what do I get? 3 prescriptions for cholesterol medicine, blood pressure medicine, blood sugar medicine. What I really needed was to step back and say, oh my goodness, you are stuck in sympathetic drive. What is causing your body to be trapped in this broken record of this part of your nervous system? And how can we reboot that to get you back down into rest and digest mode? And that means some biohacking. That means some retraining of your body to get it down in parasympathetic tone. And that's the rest and digest mode. How do you do that? Well, breath work is one simple way. Close your mouth, breathe through your nose, practice deep breathing all the way down to the bottom of your diaphragm where your belly pushes out. It's one simple way. Watch sunset, watch sunrise, gargle. This activates the vagus nerve, helps you get down into sympathetic tone. There's all kinds of ways for parasympathetic biohacking, but we have to recognize that that's the problem first and not just go to the doctor and say, my blood sugar is too high and not recognize why. Why is it too high? And if you're mouth breathing, you're likely having high cortisol. Cortisol is telling your liver to pump blood sugar out. So we need to settle down, stop being overwhelmed, put the computer away, go outside, hug a tree, spend some time in nature, get our cortisol to settle down, get our blood sugar to settle down, get our blood pressure to settle down. And then we don't need all those prescription medications. We just needed to reboot the lifestyle.
Yeah.
So we talked about physical exam signs. We talked about underlying nitric oxide, the role of nitric oxide in nasal breathing. Let's talk about the microbiome when you're a mouth breather and how might the microbiome shift and accelerate your aging.
Yeah. Well, so when you dry out your mouth, when you're mouth breathing, your saliva isn't as protective as it should be. And this allows or causes a pH shift in your mouth, which drives the pathogenic bacteria in there, the red complex bacteria, which are kind of the bad bugs, the bad guys of the salivary microbiome. And when they start to take over and become the dominant species, inflammation rises. You have localized periodontal issues. But on top of that, they start traveling to the rest of the body and can cause increase in inflammation in many spots. They cause issues in your brain and your cardiovascular organs and your gut. So that's a whole nother topic and area. But the point is that the bacteria that are the healthy ones that usually take over and allow the good things in your mouth to happen are now overcome by the bad pathogenic bacteria. And that will increase all of the systemic issues that Dr. Campbell was just discussing. Not only that, it'll predispose you to possibly decay and like I said, gum disease, but it also prevents making that nitric oxide that we talked about. So on top of that, that mouth breathing in your mouth, when I'm looking at that in the patients clinically, to Dr. Campbell's point, you look in the back of the mouth, you can see the swollen uvula. You can also see the soft palate also gets swollen and gets inflamed. And that's the area where if you're breathing through your mouth at night, a lot of times that snoring noise comes from. And snoring is never just a noise. It's an indication that you're not breathing in healthy ways at night, which is going to disrupt your sleep and your sleep cycle and age you that much faster as well. So to top it all off, now we're talking about mouth breathing causing hormonal imbalance, nitric oxide imbalance, hypertension issues, cavities, periodontal disease, and now you're also disrupting your bed partner. So, we started off talking about why mouth breathing, can age you. It's so much more than that.
Yeah. I mean, and one important point that you didn't list in all of your things that I think is important to recognize is somebody listening to this podcast might go, I'm only 25. I just got married.
Yeah.
I'm not that worried about aging, right?
Yeah.
I'm getting ready to start my family. This podcast isn't relevant to me. Well, guess what? If you do not have adequate nitric oxide and you don't have adequate blood flow to your pelvic organs, as we discussed, you're not going to ovulate as well as you would if we fixed that mouth breathing problem. And we now know that when this red complex bad bacteria get in your mouth, they can travel through your bloodstream into your placenta and get into your newborn baby. And maybe, sadly, in a few cases a year, cause so much inflammation in the placenta that the placenta disconnects from the lining of the uterus and causes fetal death. It can cause a miscarriage. It can cause a stillborn birth. And so we want every woman who's listening to this podcast who is of childbearing age to go see the dentist and have a spit test and make sure that they don't have this pathogenic bad bacteria or a mouth breathing problem that might contribute to pregnancy loss, because this is often preventable with early identification and treatment. And so I think that's an important piece that we missed in our laundry list, because we started out talking about aging, and certainly mouth breathing can age you on many levels for many reasons, but mouth breathing is a problem at any age.
Well, and along those lines too, you mentioned the 25-year-old or the young adult. There's studies out there that show that it impacts your ability to learn and retain information. My studies, I believe there's some human studies out there now too, that show that just mouth breathing alone can reduce your uh, IQ. It can reduce your ability to perform in school, and that has huge implications for every age.
Yeah.
And on top of that, it's the athletic performance. We know that nasal breathers, when they train, are getting a better athletic benefit as well. So it really does impact, every stage of the game.
Right. A child that comes to see me with a bedwetting problem has a sleep disorder until proven otherwise.
Mhm.
No child should ever be treated for bedwetting until we're sure that they don't have sleep apnea. No child should ever get a prescription for a stimulant drug for ADD until we've ruled out a sleep disorder problem first.
Yeah.
Because very often the kid with ADD has a perfectly fine brain. It's just
Mhm.
inflamed because they spent all night long struggling to get enough oxygen. Their brain is inflamed, they're sleep deprived, and they can't focus in school because they're not getting what they need at night. And if we learn that that's the problem and we help them, often children just need their tonsils out or just need a myofunctional therapy evaluation to get their tongue in the right position, or they need some orthodonture to make their airway, their mouth wider to fit their tongue so there's enough room in the back for air to flow. And we fix those things, we can lifelong cure their attention deficit disorder by fixing the underlying root cause. So it's airway across the lifespan. And yes, certainly an airway problem can cause accelerated aging.
Yeah, well, and so I'd like to talk just a minute about when I see my sleep dentistry patients, which is a huge majority of the patients I see these days is for an evaluation for oral appliance therapy for anything from mouth breathing to snoring to sleep apnea, obstructive sleep apnea. But a big part of the conversation is reducing mouth breathing or increasing their ability to, nasal breathe in healthy ways consistently. Some of the tips that I give them at home, like how to get started on this, would be nasal hygiene, using saline rinses, using neti pots, using clear spray, humidification, getting tested for allergies. I have them start by practicing nasal breathing during their walks, maybe a little lip tape when they're walking during the day, or they're working on their computer to develop the habit. Like, okay, this is what can help me breathe in healthier ways through my nose, because to Dr. Campbell's point, there is something called nasal disuse. If you don't use it, it becomes more difficult to breathe through your nose. And as you start learning and training your body to nasal breathe, it becomes easier and easier, and your body's able to help itself. Another common thing I talk about with my patient is tongue posture awareness. Your tongue should be up against the roof of your mouth. And even just do a little self-assessment right now. put your tongue low into your lower jaw and try to breathe through your nose. And then now put your tongue up to the roof of your mouth and now try to breathe through your nose. I mean, it's if your tongue's in the right position, it can help improve this. But this is something that patients need to become aware of. Are their lips sealed? And then at night, when they're wearing their appliances, sometimes side sleeping helps. Avoid sleeping on your back or get a little elevation to your mattress or bed. Make sure you're hydrated. Reduce your alcohol intake. That really has a huge impact for a lot of people. Maybe you need to look at eating anti-inflammatory foods. What does that mean for you? Do you need to be assessed for that? Do we need to get the ENT involved? I would say, to Dr. Campbell's point, 90% of the time, it's something that functionally we can work around with patients, teaching them how to use their nose, teaching them these new habits, maybe starting myofunctional therapy and really showing them, okay, this is how you breathe through your nose both day and night. Because even if you get, let's say, one of those sleep appliances that I make, one of those dental appliances to help you breathe better when you're sleeping, the efficacy of them is so much better. I mean, it's not a magic piece of plastic. You still got to put some work in to help your body learn how to function properly.
So this is a new vocabulary word for some people. They may have never heard this word before, myofunctional therapy. Can you tell us what a myofunctional therapist is, how they're usually
Sure.
trained, and what they can do?
I would love to. Myofunctional therapy is similar to physical therapy for your mouth and your facial muscles. So let's say, for example, you have been a mouth breather your whole life. You just open your mouth, breathe through it, don't use your nose. The muscles of your face have been trained to work in a certain manner, and you're used to functioning in a certain way to support those habits or necessities of how your body has been functioning over time. So just because we can clear up your nose and get you the ability to breathe through your nose, it doesn't mean that those muscles are automatically going to function in the right way. Your tongue isn't automatically going to go to the roof of your mouth because it hasn't developed the strength in the right places, the habit of the function. So there are therapists out there or practitioners that are trained specifically to help you teach you not only the habits, but also strengthen the right muscles, create the pattern that needs to happen so that you're able to function habitually over time. Strengthen the right muscles, keep your lips closed, keep your tongue up to the roof of your mouth, use your nose to breathe. And usually it's anywhere from a 3 to a 6 to a 1 year program, depending on what your needs are. And you do these sets of exercises geared specifically for you and what your needs are to help your body learn the proper way to function around this.
Yeah. So I had to do myofunctional therapy. And my myofunctional therapist was a dental hygienist before she
Mhm.
went to myofunctional therapy school. And so she gave me this whole little Ziploc pouch full of all these little things. I have little cotton pledges that I put between my cheek and gum, and then practice putting my tongue on one side of my cheek and the other, and on the top of my mouth and down on the bottom. And I have a little button that's tied to a string that I put between my lips and pucker my lips and try to hold that button while pulling the button out. And then pop it out, put it back in and do it again. And straw that you have to use for sucking, and all these little things that are pretty easy exercises. They don't take very long to do. But what happened to me over time is that between that and an appliance that I wore for, I don't know, about 3 years or so, I don't snore anymore. I am
Wow.
much happier to spend the night with a girlfriend in a hotel room, not being embarrassed by my snoring. I still lip tape sometimes, but it feels like I don't need to, like I did at the beginning. So, yeah, it's nice to not snore, and it's nice to get a deeper night's sleep without having to have surgery or wear a CPAP.
Well, and so along those lines, those exercises too, there's some fun things that you can do just on the side of myofunctional therapy. Like, did you know that the didgeridoo, that the big instrument that
From
you can blow
Australia.
in, there's actually evidence around that users of that can reduce their snoring and sleep apnea numbers because it's strengthening those airway muscles back there. So
Fun.
that's pretty fun. And
Yeah,
and
that's
and
fun.
vocal exercises. I have a good friend of mine who is a vocal coach and he coaches opera singers. And some of the exercises that they do with their vocal training really also help support those posterior pharyngeal airway things. So there's a lot of overlap there. So you can actually have some fun with all of this too. Harmonica playing, I think, is another one. Anyway,
Yeah. So we started out the episode by asking the question, can mouth breathing aid you? And I think the answer is a resounding yes.
yeah.
Can mouth breathing be diagnosed? And the answer is yes, by physical
Mhm.
exam often and by history. Can mouth breathing be treated? And the answer is a resounding yes, often without the need for CPAP, and often with a collaborative effort between your primary care provider, your hygienist, your dentist, and sometimes a myofunctional therapist. So
Mhm.
I think we have lots of hope for people that they don't have to be a chronic mouth breather forever, that there are ways that we can identify and treat this condition before it causes a metabolic tragedy. And that's great news.
Yeah. So now maybe people can know why they wake up tired, unrefreshed, clench, snore, dark circles. Hopefully we've
Headaches,
helped a
bad
lot of
breath.
people. Yep.
Yeah, we got a plan for you. Bring those concerns to your primary care or your dentist, and we'll take it from there. So thank you for spending time with us on this episode of Sleep, Sex, and Senility. I'm Dr. Ellie Campbell, and it's been my pleasure to teach you some things today. Thank you for joining us.
And I'm Dr. Kathleen Carson. Looking forward to seeing you next time.
Thank you so much for joining us for this episode of Sleep, Sex, and Senility. If you enjoyed today's conversation, please like, subscribe, and share the podcast with a friend.
Visit our website at sleepsexandsenility.com to sign up for our monthly newsletter using the link on our homepage. New episodes drop every Tuesday.
Until next time, keep connecting the dots and remember, what happens in your mouth doesn't stay there. I'm Dr. Ellie Campbell.
And I'm Dr. Kathleen Carson.
Nanoverse Media, making the world smaller.